Thank you. Yeah.
Well, I have to admit, when I agreed to do this, I had no idea that David was going to be the keynote. And I certainly didn't know that I was going to follow him. But today it's about you, so let's get started. Why do some of the world's leading innovators seem to have a knack for good ideas? Where do their ideas come from? And what makes them so good at it? Today I'm going to share 3 things that you can do to become a better innovator. It's interesting that when you decode stories of innovation, you often find that they start with a simple question. Sometimes that question seems pretty basic or even naive. And that simple question is sustained by a certain tenacity and willingness to dare. For example, take 2 unemployed guys named Brian and Joe who are hanging out in their San Francisco apartment one day with one question at the top of their mind. How are we going to pay for rent? At the same time, a big conference is going on in the city of San Francisco, but all of the hotels are booked, and people are desperate to find a place to stay. So Brian and Joe catch wind of this, which leads them to ask, why can't we find them a place to stay? And why can't they stay at our place? And this sparks even more questions like, how about if we throw in a modest breakfast? How modest? What about Pop-Tarts? You see, Brian and Joe identified a pain point, and then they started asking open-ended questions. The kind that start with who, what, where, when, or why. You know, questions that can't be answered with a simple yes or no. How are we going to pay for rent? Why not our place? What if we throw in a modest breakfast? You see, these types of questions electrify your brain. An open-ended question is like a challenge or a puzzle without boundaries. It gets our brains working right away on an infinite number of answers. Anything is possible. At times, we can't help thinking about it. And when you can't stop thinking about something, it eventually leads to more questions that can spark fresh ideas to solve today's problems. At HealthPartners, we started asking some open-ended questions about healthcare, like, how could we cut costs in half? Why do I have to go into a clinic? Why are clinic hours the same time I have to work my job? What if we were open around the clock? Why do I have to limit my relationship to just one doctor? What if I had a whole team of experts? What if my satisfaction was guaranteed? So, how do we get better at asking questions? As humans, it turns out that we're born with lots of curiosity. So, show of hands, how many of you out there are parents? Okay, a good portion of you. And how many of you parents have had the joy of raising a 4-year-old? Okay. And for those of you who aren't parents, how many of you have been 4 at some point in your life? Okay, good. Then can we all agree that nobody asks more questions than a 4-year-old, right? I mean, these kids ask like 400 questions a day, most beginning with the question, why? See, kids are really good at exploring by curiously questioning everything. Hey, Dad, why is the sky blue? Dad, what's the moon made of? Hey, Dad, where do babies come from? The research is clear. When we're young, we're curious. We explore, we socialize, we play. We feel wonder, we feel joy. And we still dare to do, and we still have hope. But by age 5, we already start to lose some of these natural abilities. And by middle school, most have stopped asking questions altogether. Now, much research has been done on this topic to understand why this happens. And one popular belief is that as adults, we fear being perceived as incompetent or uninformed. Another popular theory is that our society rewards answers more than asking good questions. So this brings me to my first point. If you want to get better at innovating, Find your inner child and start asking questions like a 4-year-old. Okay, back to Brian and Joe. Now, predictably, their free thinking ran headfirst into the wall of conventional wisdom, otherwise known as the status quo. For our purposes, let's define the status quo as a complacent attitude to keep things just as they are. We've all seen it. Some of us have maybe even thought it. Others have even said it out loud. That'll never work. You can't do that. Nobody will buy it. Hey, nice idea, maybe in the next budget cycle. That's never been done before. You see, the status quo disconnects the electricity to our brains. It deadens imaginative thinking. For Brian and Joe, the main status quo was, nobody will ever want to sleep in a stranger's bed. Yet in the face of this powerful force, they saw a worthy problem to solve. As consumers, they appreciated the need for affordable out-of-town place to sleep. As suppliers, they had underused capacity in their own apartment. So they were able to connect the dots where others couldn't even see the dots. At HealthPartners, we also see worthy problems to solve that are defended by the status quo. For us, the narrative included, you can't diagnose or treat someone unless you see them in person. Nobody's going to pay for online care. Or, I think you're just making it easier to get antibiotics inappropriately. But as consumers, we understood the need for more affordable care because we walk in those same shoes to access and pay for healthcare with our own families. And as suppliers, we saw doctor shortages, doctors working at capacity, and the untapped use of technology and available nurse practitioners so we could see and connect the dots that previously were invisible. And we saw other industries and businesses vanish because new entrants came in and disrupted them. So in the face of the status quo, we chose to disrupt ourselves. Which brings me to the second point for becoming a better innovator. Banish the status quo to your competitors. Okay, let's go back to Brian and Joe one last time to see how they bet on their ideas. So they got a hold of 3 air mattresses, and they rented them out to 3 people who didn't know each other, and everyone seemed to have a good time. And what they learned was that for sociable souls, meeting new people and staying in their homes was a huge part of the charm, Pop-Tarts included. And their success emboldened them to ask even more provocative questions like, why not make a business out of this? And what if we could create that same experience in every major city in the world? So the idea that started out as Air, Bed, and Breakfast went on to become Airbnb. They're in the hospitality business in 192 countries, 34,000 cities, with more than 2 million listings, yet they don't own a single hotel property. And according to CNN Money, Airbnb is now roughly valued at about $25 billion. At HealthPartners, we created online clinical interviewing software and blended it with compassionate nurse practitioners for a remarkable experience. We learned that people will be better off when you do things that simplify their life and respect their time and money. So the idea that started on a napkin went on to become virtuwell. We're in the diagnosis and treatment business in 12 states. We serve about 38% of the US population. virtuwell has treated over 200,000 people. It costs 300% less than an office visit, and we're the nation's benchmark for antibiotic stewardship. Yet we don't own a single clinic. And we estimate that virtuwell has saved consumers and organizations roughly $21 million and 68 years of time compared to traditional visits. So as you can see from these 2 stories, it's not enough just to ask imaginative questions or have a healthy disregard for the status quo. We have to find the courage to act on the ideas generated from the exploration. Which brings me to my third and final point for becoming a better innovator. Sometimes we have to take a risk and dare enough to change the world, like this 6-year-old. Now, I just gave you the red carpet version of 2 very different innovation journeys. But that's not the end of the story for Airbnb or virtuwell. You see, the thing is, once you change the status quo, you become the new status quo, which means that at HealthPartners, we're continuing to ask open-ended questions about things like, what would full-range primary care look like if you could design it without conventional payment in mind? What if an in-person visit were the exception rather than the rule? Why can't we connect convenient lab services with virtual care? Why can't we make it simple to connect people with the right expert at the right time? These questions are inspiring our newest prototype called Smart Care. And frankly, we're completely energized to figure out how to bridge digital and analog health to create more convenience and affordability. So as we near the end, what starts with a pain point and a question turns into a journey of exploration that involves deep curiosity, childlike curiosity, 3-dimensional thinking, and experimentation. So ask those open-ended questions that electrify your brain and live with them for a while. Be the boat rocker who gets outside the lines and breaks with convention. Allow those questions to be expanded, pulled apart, reassembled, sanded, and polished. From this, new ideas to solve old problems will take shape. Ultimately, our job is to make the world better. And to do that, we need fresh ideas. And the road to new ideas begins by asking questions like a 4-year-old, banishing the status quo to your competitors, and daring enough to change the world. And these were 3 ideas we thought were worth sharing today. Thank you.